Hey everyone, Dr. Baron Grutter here. This is going to be just a short video series focused on delegation. And now I've made a series in the past on guided surgery and with the intent of showing you how to sort of the tasks that should be done sort of set up for the doctor or the designer ahead of time to help refine the process, or I should say increase the efficiency. So this is not going to be going over all the minute details. We've got plenty of other videos that go over that. I'm just going to show you sort of walk through how things should be set up so that someone can come in and finalize the design and then output the models. And you'll see kind of how I go with this. But so this first video is going to be the initial setup to the point where we do the alignment, and that will be the end of this video. Yes, the video will hopefully be something you can kind of play while doing your first few setups so that you know the general workflow without having to see videos that go over every small detail. So here we go. First thing I'm going to do is I'm going to show you that I'm in Blue Sky Plan in the orthodontic module right here. I have this folder right down here that has my I've just called it a demo patient. It's got some photos of the patient, and it's got both the lower arch and the upper arch that I have exported from my CareStream CS3600. So ideally, all this data should be ready to go once the patient's been imaged and all the data gathering. So we've got this ready to go, and we're ready to start a case. So first thing I'm going to do is I'm going to click on this button right here, which is to start a new case. I'm going to click, you would search for the model, the folder. I'm going to click on the maxillary anatomy file here. Yours might be named something different. I'm going to call it the maxilla. Now this is a little different from my other directions. I'm going to go ahead and import the opposing right now. We've changed the workflow just a little bit, and I'm going to go ahead and name this patient demo patient. Okay. Click forward, and so at this point I can start marking the teeth, but it automatically wants you to mark. So what I'm going to do is I'm going to uncheck that so that it's clear here. I'm going to trim up all the excess data, and I'm going to do that pretty quickly here. I'm just going to hold the shift button and let go of the shift button, let go of the mouse. It'll clear off that extra data. Let's check this box so that window doesn't keep popping up every single time. We want a good 3 millimeters of data behind the teeth. Beyond that, it doesn't really matter. We're just trying to get reasonably smooth borders. We can also do sort of a plain cut doing it this way. Again, I've got videos that sort of detail this much better. And you can spend however much time you want. You do want to have a nice, smooth internal area on the palate or the lingual, the lower. It's going to help with your printing. If you don't do this, you're going to have printing issues. So do not skip this step. The bigger the area, the longer it takes. I'm going to make sure I'm looking right down the bottom. I'm going to zoom out, center the heels, up, down on the screen. I'm going to come right through here. And actually, I don't like this cut, so I'm going to double back on it so it doesn't cut anything. I want to get to this data point right here. Okay. All right, so if I look from the side, it's a fairly vertical cut. There we go. So now I can go ahead and mark the teeth. Mesial, distal, mesial, distal, mesial, distal. No missing teeth here other than third molars. So mesial, distal. If you're missing a premolar, try to mark it on the lingual aspect, the palatal area. There may be an issue if you mark in the buccal. It's not supposed to be an issue, but I've heard some possible reports of, just mark it in the lingual area. Finish marking. Okay, let's close the model. This is just going to make a base because before the model was hollow on the underside, where we trimmed all that excess off, and now it's going to give us a nice smooth extruded border or base. There we go. Good, looks good. Let's go to the mandible. Again, let's uncheck the marking teeth. And let's trim the fat. There's a whole lots of different ways to do this. It may have double backed on itself right there. We'll doesn't look like it did. Okay. Lingual looks halfway decent. That's probably unnecessary. Didn't really help much there. Would have been nice to get a little more data apical to that molar, but it'll be all right. Don't like rough borders out here. All right, did I get this one? Yeah, I'll trim that. Not probably that necessary, but okay. Don't have much landing area back here, which sort of complicates it a little bit, but we will be fine. Get the heels in the center of the window. Yeah, I'm probably gonna have to clip right off there, unfortunately. Yeah, I don't like that. I don't really actually want to cut that heel off, so I'm gonna try again. Yeah. Okay. I don't want this thing hanging over here because that's gonna affect printing stability. So it might have it would have been nice to get more data back there. That's just the truth. That's quality control on our end. We should have done a better job there, but I'll figure out a way to address that. Okay. Okay, so let's go ahead and mark teeth. Some parts of this video I might pause or fast forward so you don't have to sit there and watch me do everything. This is a pretty quick step, so I'm not going to bother with it there. But maybe when we get to the segmentation process and stuff, I'll pause to expedite the video a little bit. Alright, and once again, that's the hollow model that we're going to close right now. So yeah, and some of these things, by the time you watch this video, some of these features, we'll have some new updates coming out very soon, so some of them might not be the case, but it should be pretty obvious. I mean, this video is not going to be a bad video based on the updates. It's just going to be, you might not have to do all the steps I'm doing here. So let's continue to segmentation. So we've marked all the teeth. Now the software is going to estimate, it's going to guess where it thinks the gingival margins are. Sometimes it's good, sometimes it's not great. It's just, the more refined and the better the model is, the easier the software it is for the software to guess. The more crowding there is, the more difficult it is. And the less you get in those embrasures when you're scanning, the more difficulty it has. So I'm going to go ahead and scan. Now I like to start in the lingual of the uppers, and generally I jump to the buccal of the, start with the buccal of the lowers. That's just because the way the model starts. I don't like lines that overlap here. We don't want that. They should never overlap, because if they do, that's saying that the two teeth are occupying the same space, and that's, you know, logically illogical. So that doesn't work. And I'm just clicking on a tooth, changing, and I'm just holding the shift button while I draw this line. I can grab individual nodes and adjust them if it's going to be a little bit easier. I do most of my corrections, the largest corrections, with just drawing the line, but for the fine tuning I will go ahead and just grab a node. Okay. You do need to address every tooth, not just the ones you're planning to move. Now, you don't have to be perfect on these back teeth if you're only moving the front teeth, but still get them in generally the right area. It's going to be to your benefit. Take the extra minute or so and get all the teeth somewhat accurate. And then, of course, the teeth you're actually planning to move, get them quite accurate. This is a very young patient, hence the short clinical crown. Crowns, they just haven't. She's a teenager, and so her teeth will continue to erupt with time, or I should say, the tissue will retract a bit, whichever combination of the two. But all right. you're drawing these lines, you know, you can, if it falls slightly in the tissue, slightly in the tooth, whatever, it's not a big deal. If I had to pick, I would rather it fall in the tissue more than the tooth. But truth be told, neither one is going to be a big issue, because we're talking about, we're not talking about crown margins where you need to be, you know, accurate within the tenth of a millimeter. We're talking about flexible plastic retainers. So you've got quite a bit more, well, no pun intended, flexibility. Plus, we're looking at sort of the gross alignment, you know, the general alignment of all the teeth, as opposed to, you know, the finest little detail of a margin. Okay. All right. And here we are, last tooth. Okay, the last thing we want to do is we want to make sure that the incisal embrasures is the anterior teeth, that there's a red line crossing it on both sides, both teeth. See how it disappears here? We don't want that, so I'm just going to drag a node right over top so that the line never disappears. Anywhere it disappears in the model, the software doesn't know where to cut to separate the two teeth, the two surfaces. So don't make it have to think harder than it should. It won't always cause issues, but it can, and why not just keep it from having it happening at the get-go. So just spend an extra you know, minute or two here getting this just right, and it will help you. It will pay off in the long run. You can always come back to this phase if you found that when you go to align your teeth, the teeth are like they're oddly shaped and they don't seem to have separated properly, or the shape doesn't seem to be accurate. Well, you just come back to this step, look at your lines, and adjust them as necessary. Posterior, they don't usually have much issue. You can just kind of look at the lines, see if they overlap, and we're good. Now I'm going to go ahead and set some teeth static. This patient, you know, I'm going to go ahead and just set her second molar static. I think we're going to do some expansion on her, or some tipping of the posterior teeth. So I want everything to be active. Those second molars, I'm going to go ahead and lock those, because generally speaking, we're not going to be able to move every single tooth. We need something to anchor all of our movement, and everything's going to move relative to that. But that's getting a bit in the weeds. Just point being, when in doubt, set the second molars as static only, and then let everything else be fluid or active. Alright. And I'll go ahead and pause this video now. Okay, so I finished marking everything, and I haven't checked the incisal embrasures. I figured I'd just open that back up just to, you know, start playing the recording again while I make these quick corrections. Just do not forget this. It's a simple thing to fix, and it will save you some headache later on. So for instance, right here, the line disappears. You can see that the blue, the teal, and the red both disappear, which means neither one of them are telling the software where to separate this tooth. And that's not doing you any favors. It really needs to know which tooth is which in every area. So again, take the time, let it tell it what to do. I know it can seem tedious, and I would say it, and I would be honest, it is tedious, but alright. Right here as well, I can see these lines are disappearing, so let's make them not disappear. There we go. And this is one of the areas that is in active development to help reduce this time and this workflow necessary. So, and then lastly, see how crowded these teeth are. As I was saying before, the more crowded they are, the more you know, the more of this there is, because it's sort of a smooth transition here, and the software's like, okay, where do you want me to put the line? And it just guesses, and so we need to go back and edit it. All softwares are doing the same thing. Some are more efficient at it than others. We'll give it that, but they're all trying to guess the same thing. So no matter what software you're using, you really need to go back and check this step, because you know, the computer can only guess so well. So, all right, there we go. See if in the posterior there were some areas, but I kind of corrected them as I went along. But I don't see any more right here. All right, we should be good. This is sort of silly, but I'm going to go ahead because I can get pretty picky. There we go. Okay, I'm going to set those second molar static. And now I'm going to continue the teeth moving. I'll go ahead and pause. This can be quick, sometimes it's not, and since I'm recording, recording tends to be a little bit, make this process slower because the computer's doing so much. I'm going to go ahead and click save, and I'm going to come right down to this digital ortho delegation demo, and there we go. It's already ready to go. Just going to click OK, and now it's going to save it again. Duh. Save your project before you walk away, because this could be you're done for now, and you might not get it back to actually checking the setup for a couple days later. Who knows? You get this done, and it's ready to go. So, all right, that's it for this video.